Good, happy Wednesday evening, June 29, 2022. I'm Riley King. Welcome to this Wednesday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Wednesday evening, so let's get started right now. First probable case of monkeypox identified in New Hampshire. Let's take a listen to that video from WMUR News 9.
Lawns of old were nothing but trouble, you see. Why not use 30% less?
That's right, Jamie. I just spoke with the chief medical officer here at DHHS, and he says while this probable case is a concerning development, the risk to the general public remains very low. Now, the Department of Health and Human Services says the patient lives in Rockingham County. It's unclear at this time where that person may have contracted the virus. State testing identified the probable case, and now the CDC is doing confirmation testing. Now, monkeypox is a rare disease caused by the monkeypox virus, which belongs to the same group of viruses as smallpox. Transmission of monkeypox requires close interaction with a symptomatic person. Symptoms include fever, headache, exhaustion, muscle aches, sore throat, and cough, followed by a skin rash.
Risk to individuals, the general public in New Hampshire is very low. It's low for many reasons because of the way the virus, the monkeypox virus, spreads. It's spread through physical contact, close contact, sexual contact.
Now, DHHS says it expects to receive those results from the CDC in the coming days. Reporting live in Concord, I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. As climate warms, tick danger grows for New Hampshire moose population. Let's take a listen to that video from WMUR News 9.
PNC Bank believes that if a pair of goggles can help your backhand get better, then your bank should help you budget even better. Virtual wallet with low cash mode from PNC Bank. One way we're making a difference.
Climate change is kind of the kicker in here in that you need lots of moose and you need favorable environment for the ticks to be so abundant.
Pete Peekins, retired UNH professor of wildlife ecology, is concerned about a warming climate extending falls and springs and causing less snow, because that means the winter tick will thrive in a state that has a high-density moose population.
Winter has been delayed 2 to 4 weeks now for the last decade, and that spring comes earlier. Those conditions play to the advantage of the tick.
When ticks search for a host, it's called the questing season, and with warmer weather, it's getting longer.
Moose acquire larvae in the fall, and these larvae are in pods of hundreds of larvae together, so a moose doesn't get one tick. It gets hundreds at a time.
That's one big difference with the winter tick versus other ticks. They quest in clusters instead of one by one. A study conducted from 2014 to 2016 for moose across parts of Maine and northern New Hampshire found a 70% calf mortality rate due to winter tick infestation.
There's nothing sadder than looking at these calf mortalities. I mean, these animals are literally being drained of life.
These death rates are unprecedented, and as many as 50 to 100,000 ticks have been found on a single calf.
That adult female is basically the size of a medium-sized grape, and she's that big because she's engorged with blood. So 50,000 beats on that one calf. And so when you run the math, its entire blood volume is gone in 2 weeks. And nothing can survive that.
The winter tick has been around a long time, but has only started causing a problem for the moose population in recent years, a big factor being the changing, more favorable environment.
We've seen larvae on the landscape in December. and it's not a coincidence. The following year, we had really high cap mortality. It's that, and that is climate change.
The good news is that the winter tick doesn't affect people or transmit diseases to humans like other ticks can. But with climate change, there have been noticeable differences in other tick species too, like the black-legged tick, which does carry Lyme disease.
What we know right now is that our tick season is expanding. A couple of decades ago, we didn't have near the amount of trouble with black-legged ticks as we do now.
Abigail Matthewson from the State Department of Health and Human Services says with longer tick seasons, there is greater risk for disease transmission to humans.
If they're not covered by snow and it's a nice day and they haven't had anything to eat, they're going to come out and look for a meal.
In New Hampshire, there are roughly 1,500 to 1,700 new cases of Lyme disease reported each year, a high rate for the population. There have also been increases in other tick-borne diseases, and a warming climate brings concern about more tick species, like the Lone Star tick.
It's definitely expanding its range in the last several years. It's been moving up from Rhode Island to Massachusetts. There's been some detections in Maine.
For now, it's important to take precautions like doing tick checks, using repellent, and treating our pets.
Doing all that protective stuff we tell people to do seems to be working and bringing the incidence rates down a little bit in that southeast part of the state, which is great.
And that's one solution, adjusting our own behaviors or habits. With the winter tick and moose, it's a little trickier.
We don't see a solution other than reduced moose density, which effectively reduces tick density because it's a single host parasite system.
Now, that may seem counterintuitive, but it could mean healthier moose in the long run. For forecasting our future, I'm meteorologist Jacqueline Thomas, WMUR News 9.
Okay, and there you go on that video and that report. Federal authorities announce initiative to combat unlawful prescribing of opioids in New England. Let's take a listen to that video from WMUR News 9.
You want to smell like coconut and vanilla, eucalyptus and mint, sea salt and cedar?
Yes, please!
Then sniff no further!
You smell amazing.
Thanks! It's Native. Clean, effective, all-day deodorant. Native has fantastical scents like coconut and vanilla, sea salt and cedar, eucalyptus and mint.
It will focus primarily on medical providers in New Hampshire, Maine, and Vermont who are illegally prescribing and hence distributing opioids into our community.
A show of force from Washington, D.C. Wednesday. Highly decorated, high-ranking law enforcement officials from the FBI, DEA, HHS, and the Department of Justice flew in to make an announcement and a statement.
In recent years, some of the greatest spikes in overdoses, overdose deaths, and aberrant opioid prescriptions have all occurred here in the New England area.
The mission of the New England Prescription Opioid Strike Force, NEPO, can be summarized in 14 words.
To hold medical professionals accountable for fueling the nation's opioid crisis through drug diversion and fraud.
U.S. Attorney Jane Young says it's a boon to have the hub in Concord and urges the public to call in with tips or suspicions, and they'll do the rest.
I cannot say how honored and grateful I am that it's here in New Hampshire, and I think, quite frankly, everyone in this state should be grateful for this opportunity.
4 dedicated prosecutors will build cases in the New England region against alleged pill pushers.
To those rogue actors, the NEPO Strike Force is here to ensure that your criminal conduct comes to an end.
And the NEPO Strike Force is right now working in the region, but tonight they are asking the public to help them, to be their eyes and ears. So if you'd like to call in someone, a health provider who you suspect, you can call 1-800-CALL-FBI or email at tips.fbi.gov. We're live in Manchester this evening. Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Hearing held over hundreds of lawsuits alleging abuse at Youth Detention Center. Let's take a listen to that video from WMUR News 9.
bigger, better, legendary. Alpine Adventures is New England's zip line and outdoor adventure destination. We know fun, and we do it differently. Pick your adventure or do them all. Alpine Adventures. Get out of your element at alpinezipline.com.
At least 24 attorneys identifying themselves in Merrimack Superior Court, some with the state, most representing hundreds of individuals in civil cases alleging sexual and physical abuse in the state's youth detention center.
That's why we're here today, trying to get the court to allow us to begin discovery, start taking depositions, and start shining a light publicly on all of these state employees that have been abusing kids for over 60 years.
What you saw today is the beginnings of what's going to be a long and a complicated process consistent with sort of the complexity of the cases themselves.
The judge weighing in.
Say one or two of these cases go and we hear from a jury as to what they think. It wouldn't make sense to have 600 cases go at once, because how could a jury keep track of that? And it doesn't make sense to have one get tried every month for the next 35 years.
The state's alternative of settling cases out of court with a $100 million fund was not discussed. Attorneys for over 400 of the claimants have said its $1.5 million individual cap is insultingly low. But one lawyer we spoke with plans to steer clients to it.
The state did the right thing. They set up this fund, and claimants, most of them, probably 90% of them, will do fine with the fund.
Now, there's another hearing about the civil litigation process next month. It and the state's final $100 million fund process are still evolving. Live in Concord, Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. New Hampshire Attorney General says new law on federal gun regulations might not be that sweeping. Let's take a listen to that video from WMUR News 9.
Buying or selling a home is a complex process, and for many, the largest financial transaction of their life.
Republicans in Concord wanted a bulwark against federal overreach on firearms regulation when they passed House Bill 1178 this year. The legislation prohibits state officials from doing anything to help enforce federal gun laws that are incompatible with state law. But today, Attorney General John Formella told the Executive Council the new law may not be as sweeping as some believe.
The law is narrower, I think, than it's been reported. It doesn't try to say that federal firearms laws aren't enforceable in New Hampshire or in effect in New Hampshire. It just deals with what state and local agencies can do to cooperate and assist with the federal government in enforcing those laws.
Already facing questions, the AG's office issued a memo Wednesday saying it is working on guidance for local law enforcement that now has to make sure before officers enforce or cooperate on a federal case that state law lines up with, quote, any federal law, regulation, or executive order regarding the regulation of firearms, ammunition, magazines, or the ammunition feeding devices, firearm components, firearm supplies, or knives. Democrats say the law could hinder the implementation of any expanded background checks or new red flag legislation that might pass in Washington.
90% of the citizens of our country believe that there should be universal background checks, and we should be doing them here in New Hampshire.
We spoke with Governor Chris Sununu about this new law earlier this week. He says he does not anticipate significant conflict between state and federal gun laws or problems for local law enforcement.
We feel very confident about the law as it moves forward, but the Attorney General always reviews laws that have any impact with the federal government just to make sure that we're dotting the I's and crossing the T's. But so far, we feel very confident that, as we move forward, the federal laws are the federal laws and the state laws are the state laws.
In Concord, Adam Sexton, WMUR News 9.
Okay, and there you go on that video and that report. Executive Counselor presses governor on whether New Hampshire will aid other states' abortion investigations. Let's take a listen to that video from WMUR News 9.
Buying or selling a home is a complex process, and for many, the largest financial transaction of their lives.
At the Executive Council table, a tense exchange over the new national legal landscape for abortion rights as Councilor Cindy Warmington presses state health officials and Governor Chris Sununu over what the response would be if states where abortion is banned want to investigate residents who come to New Hampshire to receive abortions.
Governor, are you taking any steps to protect patients and providers?
No, again, nothing based on the Roe v. Wade decision. Nothing has changed from 2 weeks ago to today. The same people have the exact same choice. That's it.
Governor,
I can't affect laws in other states.
I fully understand that the Roe v. Wade decision did not affect you personally. But for half the population, we just became second-class citizens.
Warmington says the governor should follow his counterparts in other states who have signed executive orders to protect against the possibility of out-of-state prosecutions of abortion.
They're going to stand up for the patients and providers and provide them that protection.
Yeah, we're not taking any additional action because
you're taking no action.
Yes.
In the face of pro-choice outrage, Republicans continue to say the current abortion law in New Hampshire banning the procedure after 24 weeks gestation is not going to change. Many see passing new protections as a pointless gesture. House Majority Leader Jason Osborne tweeting, quote, "Do you stress out about needing your right to eat a PB&J codified, or do you just eat it and move on with your day?" Democrats contend that inaction and humor are not what the state's pro-choice majority wants from its elected leaders right now.
The majority of New Hampshire residents, whether they're Republicans or Democrats, believe, number one, that doctors and patients have a very personal and intensely private relationship, and that this state has no right to intervene.
Late Wednesday afternoon, the governor issued a statement about his exchange with Councilor Warmington, saying, quote, "New Hampshire will not aid or assist in another state's investigation or prosecution. We will not be extraditing individuals or doctors for what other states perceive as unlawful." In Concord, Adam Sexton, WMUR News 9.
Okay, and there you go on that video and that report. And that is it for this evening edition of the Riley King Newscast, right here on the Riley King Network. Thank you for tuning in and watching. Have a great evening. Good night and goodbye.